The patient's very happy, they had a denture, they're now rid of that denture, and I think it's very much worth it. Hi, I'm Peter Doherty, one of the dentists here at 3Dental, and what I do is dental implants. And this particular case is quite an interesting one. It is a single implant at the front of the mouth, but it's interesting because this patient came to me with an implant that had been placed at a different clinic. It was a clinic that was abroad for dentistry. He came to me expecting me to be able to put a tooth on top of that implant, but unfortunately when I assessed his case I found out that the implant was not in a great position and the treatment couldn't be done. So we had to do some remedial work first before we could actually get him his tooth. This is how my patient came to me. His lips are retracted, they're lifted back so you can see exactly where his implant is. He's missing this tooth here, right at the very front of his mouth, and our implant is quite high up here. I think you can already determine that it's probably not in a very good place to be able to put a tooth on. And when we look at it from underneath, the gum and the bone are out here along the teeth, but when we get to the implant it really dips in. So we've certainly lost some tissue, whether it's hard tissue, bone, or whether it's soft tissue, gum, and we'll determine that in a little bit. Also, when I look at the trajectory of the implant, the way the implant is facing, you'll see here that the angulation of the implant is very much out through the front of the tooth, and it shouldn't be like that. It should be aligned with the rest of the teeth. And I've also taken a scan, this is a CT scan, that shows us the implant at that angulation, and this is the bone here. The implant should have been placed like this, but it was placed at an angulation that was incorrect. Unfortunately, there was nothing we could do here but take out the implant. Several weeks later, when things have healed up, the gum has healed up here nicely, we reassess the case and decide what we need to do. And in this particular case, when we look from underneath, we again see this big defect. On our scan, when we look at it, we don't have enough bone. Bone has been lost here. And whether it never existed in the first place or whether it was as a result of the implant surgery, I don't think we'll ever know. We took some bone from elsewhere in the mouth, which is an autogenous bone graft, and the bone was taken from the lower jaw and transferred to the upper to build that bone back out again. That's all stitched up then, and it's left to heal for a period of 3 months. After 3 months, this is the result we get. And there's still a bit of a defect here. We know we've built out the bone, so what we're missing at this point now is some soft tissue or some gum. We also took a sample of gum from the palate and we used it to bulk out the gum in this area. This is a little cover on top of our implant, and we've got some stitches here as well. These 2 stitches hold our gum graft in place. These just close the tissue together. So we're gaining extra bulk by doing that. This is it after it's healed. 3 months later again, this is the top of our implant, and you can see now that we've regained that volume on the outside. So where we had a big dipped area from the previous surgery, now we've got something much better and much more aesthetic, something we can make a proper result from. And then this is our final tooth. There's a little screw hole here. This is on the palate side. Again, we're looking at the palate. That screws the implant into the position of the crown onto the implant. The previous old implant would have come out somewhere in this direction, completely in the wrong position. And then with the lips retracted, this is our final result. So nice gum around this tooth. We've tried to mimic some of the characteristics of the neighbouring tooth as well by that. And then this is our smile view. Patient's very happy, they had a denture, they're now rid of that denture. They don't have to worry about it falling out or moving around or cleaning underneath the denture, because this is rock solid. It's just like having a tooth in your mouth. So a lot of work for one single tooth, but if it means that you don't have to wear a denture and you can go around living your life without worrying when it's going to shoot out of your mouth, then I think it's very much worth it. So if you're interested in a treatment like this, like an implant treatment, you can look at our website 3dental.ie. There's numerous ways to contact us to make this treatment as accessible and affordable to as many people as possible. We offer free consultations, payment plans, and also finance options.